Hello Gail and classmates. Welcome to Group 10 presentation. Now I'd like to start our presentation by introducing the family members of our case scenario. Tom, 50 years old, and Mary, 45 years old, have one daughter, Chloe, 13 years old, and one son, Peter, 10 years old. They have been married for 20 years. The Tom's family immigrated to Canada 11 years ago when their daughter was 2 years old, and their grandparents joined them a year later when their son was born. Tom is a full-time professional accountant in a successful company in Toronto. Mary is the keeper at home. She's mostly at home taking care of children and the grandparents. She used to work as a dental assistant before her son was diagnosed with ASD, Autism Spectrum Disorder, 7 years ago. 6 months ago, on Saturday morning, Tom was gardening outside and he suddenly felt a numbness on his right face and arm. He could not speak or understand what Mary was saying. He had dizziness and lost his balance. Mary called 911 right away and stayed beside Tom. Mary asked Chloe to call the next door neighbor who was a nurse to come for help. Paramedics came after 15 minutes. They asked some questions about his situation and the symptoms he's having now and have had in the past, previous medical problems or operations, and any illnesses which run in his family, and a current list of all medications he took. They checked his pulse and blood pressure and examined his heart and lungs. Paramedics also asked some questions to check his memory, speech, and thinking. Paramedics took him to the hospital, and later he was diagnosed with a stroke at the hospital. Stroke risk factors include high blood pressure, cigarette smoking, heart disease, diabetes, and transient ischemic attacks. Tom had chronic heart failure, which is a risk factor for ischemic stroke. He managed his blood pressure by eating a balanced diet, maintaining a healthy weight, and exercise and taking prescribed medication by his doctor. He smokes 5 cigarettes a day. Tom has type 2 diabetes, and his blood pressure is controlled by diet, exercise, and medication. And symptoms of a stroke include sudden numbness or weakness of face, arm, or leg, especially on one side of the body. Sudden confusion or trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness or loss of balance or coordination. And sudden severe headache with no known cause. Now I'd like to talk about the structural characteristics of Tom's family. Tom's family is an extended family which consists of Tom, his wife Mary, Tom's parents, Tom and Mary's children, Peter and Chloe. As their extended family, they take care of each other. And the ages of family members. Tom's father is 50 years old, Mary's mother is 45 years old, Peter, youngest child, is 10 years old, Chloe, oldest child, is 13 years old, and John, grandfather, is 85 years old, and Janet, grandmother, is 80 years old. Tom's family was migrated from the Philippines. Regarding health pattern, heart disease affects in prominent degree peoples in the Philippines. And occupations of family members or grade school. Tom is a full-time professional accountant in a successful company in Toronto. Mary is a homekeeper. Peter, the youngest child, is grade 4, and Chloe, the oldest child, is grade 8. John, grandfather, is a retired civil engineer from the Philippines and is unemployed. Janet, the grandmother, retired teacher from the Philippines, and she's unemployed in Canada.
Hello class, my name is Angeline Quillian. Today I'm going to talk about the structure of the family, focus of care for the family, health status of each family member, socioeconomic status, and environment. First, we're going to see structural characteristic of Tom's family, current health status or health problem of each member. 6 months after stroke, Tom can walk with the normal gait. Tom, the father, suffered from stroke 6 months before. His right side of the body went numb. He lost his speech at the time of stroke. Then he regained his speech in the ambulance when the paramedics delivered oxygen to him. Right now, he is undergoing physiotherapy sessions every other day. With that, he is regaining movement to the right side of the body. Also, the only thing he could remember when he had the attack was his wife panicking and rushing to him. His right hand and fingers clenched after stroke. Tom has chronic heart failure, type 2 diabetes, and smokes 5 cigarettes a day. Tom had been controlling his diabetes and chronic heart disease by diet control, exercise, and by taking prescribed medications from his doctor. Current health status or health problem of each family member. Tom's son Peter has autism spectrum disorder. He was diagnosed to have ASD 7 years before. Mary was suffering from depression and anxiety and affected with mood swing disorder. Mary is the wife of Tom. She is suffering from anxiety disorder, depression, and mood disorders. Chole, the daughter of Tom and Mary, is suffering from anxiety and aggressive behavior. Tom's mother, Janet, is suffering from hypertension and she is taking 4 different medications to control that. Tom's father, John, is diagnosed with mild Alzheimer's disease. Focus of care. The focus of care in this family would be Tom and Peter. Mary was suffering from depression and she needs guidance and counseling. Mary's daughter Chole had anxiety and aggressive behavior. Socioeconomic status of the family. Tom's financial status was above average before stroke, since he was working as an accountant in a reputed company in Toronto. Tom was able to pay mortgage and family expenses. After stroke, family's financial status was affected. Tom was the breadwinner of the family. After stroke, the family's financial status would be at stake because Tom is not working since he got sick, and they have to meet the expense of the big family, the mortgage, the daily expenses, and the treatment needs for Tom, Peter, and also for Chole. Environment. The family live in Peterborough. Peterborough is a town outside of Toronto. The place is safe to stay and to build a family. As per some of the studies, Peterborough is the best place to retire and to have a family because this place is very safe and also free of other issues. There are less crimes and catastrophe in Peterborough. The population in Peterborough is 81,779, and Peterborough is known as the gateway to the Kavarthas, the cottage country. Thank you.
Hi everyone, my name is Lemuel and I'm gonna discuss to you the strong relationship with the family. First is the family physician. Next is the support from the church. Third, family health knowledge. Fourth, Medicare. Next is school, special education for the kids, for Chloe and Peter. Next is job security, insurance connected, interdisciplinary team, and family communication. The weak relationship with a family are friends not supportive, mental health services, hobbies, private family care clinic, and the next one is tense relationship with the family. Tom's work. Tom cannot work full-time because of his recent illness. Next is family stress management, with the special needs that the kids needed and with Tom's situation. Next is demonstrate manners, profound act of kindness, courtesy, respect, and politeness to the family. Provide therapeutic relationship and client-centered relationship. Next is nurse needs to be sensitive and understanding when it comes to the feelings of the patients. Nurses can offer information about family support and social support, community services, health services, and health teaching. Nurse needs to be respectful and concerned about the patient's rights. And we have the 5 therapeutic questions you would ask and engage the family in. First one, I noticed that you do all the work in the house by yourself since your husband was diagnosed with stroke. Next, I know that you are the only one who is taking care of your family. How did you manage to do it? Third, have you shared your feelings about your situation right now to your family and friends? Fourth, I understand what you are going through right now. I can refer you to a social support and community services to help you. And the last one is, do you want to discuss and share your feelings right now? I am here to listen and offer help. Thank you.
Hi, this is Mary Theresa Modara, and I'm going to report about the important psychosocial consideration to examine the family, difficulties or challenges faced by the family at present, 5 commendations offer to this family in this situation, and tools to engage and support the family. Under the important psychosocial consideration to examine the family are presenting the problem, basic information, family history, relationship, medical history, support systems like emotional support, instrumental support, informational support, and appraisal support. In addition to important psychosocial considerations to examine the family are education, employment, and spirituality. The difficulties or challenges faced by the family at present are financial, emotional, and caregiver exhaustion. The 5 commendations offered to this family in this situation are informational support, use the family's language, commending a family's competence, resilience, and strength, changing the view families have to themselves, and establishing a rigid dichotomy in the language. The tools to engage and support the family are the Family Assessment and Intervention Model, the Intervention Model and the Family System Stressor, Strength, Inventory by Berkey and Hanson 1991 and 2001. It helps the family identify current stressors and builds interventions based on the strengths of the family. And the Family Genogram and Family Echo Map. It provides information about family members and their relationship.
Hi classmates, my name is Marina Matthew. Today I am going to talk about family care plan for Tom's family, priorities for this family, interventions implemented to this family. Family care plan. It including ability to communicate, demonstrate effectively parenting approaches, nutrition management, empathy with children, interpersonal skills, knowledge about self-care, emotional control, relationship with parents. Talking about ability to communicate, parents are able to express feelings and thoughts effectively with regards to the family and child issues. Demonstrate effective parenting approaches. Parents are apply flexibility in parenting role. Caregivers have knowledge of multiple parenting practices and are able to implement them effectively with their children in manner that is consistent with the child's development and needs. Nutrition management. Parents or caregivers provide healthy diet. Empathy with children. This item refers to parents or caregivers' ability to understand and respond to their children's sorrows, joy, anxiety, and their feelings. Knowledge about self-care. Then interpersonal skills. This item refers to child's ability to make and maintain friendship or relationship with their age group. Emotional control and the adolescent's ability to manage his or her emotions. Relationship with the parents, that is an adaptive relationship. If the child has a greatly positive relationship with their parents or primary caregivers, the child appears to have formed a secure attachment and can turn to primary caregiver for a security, comfort or guidance. Moving to the next part of this presentation, it's priorities for this family. In Ma's family, our priorities would be the following. Firstly, as we know, the family size is beyond what family resources can adequately provide, like a family income. Secondly, interrupted family process related to illness in the family. As we discussed earlier, Tom is the head of the family and he is diagnosed with a stroke. So that's why the family process has been interrupted. Lastly, the presence of stress points or foreseeable crisis situation. Children need constant support and daily assistance. Then interventions implement at this family. Refer family to social services for financial assistance and community agencies for an appropriate follow-up care, because it helps to reduce the economic burden for family caregiving. Resources such as adult daycare, home delivered meals and home health care to ease the burden of the family caregiving. Secondly, assess the family resources and support system. The family and social support systems are associated positively to coping effectiveness. Some cultures are more accepting of this responsibility. However, factors such as blended family units, aging parents, geographical distance between family members, and limited financial resources may hinder coping effectiveness. Allowing other family members to support at family's current situation with ease burden to the caregiver. Third one, it's allow the caregiver to express their concerns, problems and feelings. In this case scenario, we can ask Mary, she's the mother and she's the one who is managing or taking care of the husband and their children. So here let Mary express her feelings and concerns, because the nurses mainly in this case the nurses are trained in an excellent position to give emotional support and providing guidance throughout the stressful situation that the family is facing. So in this condition, if once Mary has expressed her feeling, the nurse can assist her. Recommended use of available community resources such as home health care, adult daycare and geriatric care. Resources like it will give the grand opportunity for multiple competent providers service on a temporary basis for a more extended period. Thank you so much for listening.